Hello everyone, and welcome to the Sleep Grand Round sponsored by the American Academy of Sleep Medicine Foundation. Today we have Dr. Tara Zipperin, Pala Zipperin, and Phyllis Payne from the Start School Later joining us to discuss the state of sleep health in K-12 education and what you can do to help. Before I introduce our speakers, I'd like to remind you that your audio is muted and your video is off. We encourage you to include any questions on this topic or for the speakers in the Q&A section of the Zoom platform. This webinar is being recorded and will be shared with everyone that registered for the webinar. This webinar is approved for 0.75 AMA PRA credits. So the Sleep Grant Rounds aims to feature AASM Foundation funded work that addresses practice gaps in sleep medicine and sleep health. Per the updated Accreditation Council for Continuing Medical Education Standards for Commercial Support, the ASM has implemented a process requiring each speaker to disclose and resolve all conflicts of interest with any commercial entity. We have reviewed the disclosures and resolutions and believe the submitted citations comply with the ACCME standards. The disclosures and resolutions provided by the speakers are included in the slide presentations for the attendees' information. Now, allow me to introduce our speakers today. So Dr. Zipperin is the co-founder and executive director of Start School Later, a nonprofit dedicated to school hours compatible with healthy sleep. She is not only a historian of medicine, but also a captivating science writer. She was awarded the Sleep Research Society's Public Service Award for her dedication to healthy sleep. Palace is the Sleep Education Project Manager at Brigham Women's Hospital. She is leading the charge with Sleep 101 and Let's Sleep initiatives. She also brings her insights as a former school board member to the work done by Start School Later. And Phyllis is an implementation director at Start School Later and a health educator and advocate for teen sleep needs. She is co-founder of the Start Later for Excellence in Education proposal and a driving force behind later morning start times and joining hands with Let's Sleep to spread sleep health education far and wide. So thank you, ladies, for joining us today. I will pass the mic over to you.
Thank you, Vanessa, and that was a great introduction. You saved me a little time. I'm Tara Zipperin, as you heard, and I'm just going to take a few minutes of your time before handing the rest of the presentation over to my colleagues who have really some very exciting and I think new, inspiring information to share with you. I just wanted to give you a little background on this project and our organization, because my understanding is that we have people here from a variety of backgrounds. So just so you have a little perspective on where this is all coming from. As you heard, Start School Later is a nonprofit coalition, obviously trying to start school later, which I'll briefly explain, but dedicated to healthy adolescent sleep as the grounding for that enterprise. And we have we were started in 2011, and we have at this point 158 volunteer-led chapters around the country and the world. We actually are represented in 4 countries at this point, and that means a lot of on the ground boots who are spreading the word and trying to educate and raise awareness about these issues. So that's great. But what you may not know is, the reason behind this. The reason we do this is because there is compelling evidence showing 2 basic things. The first is that, and many of you know this, sleep plays an absolutely critical and essential role in virtually every aspect of human growth, development, and functioning. So that's number 1. And number 2 is there's equally compelling research showing that due to non-negotiable biological changes at puberty, as well as social realities, most schools in the United States and in many places around the world start at times that make it impossible, virtually impossible, for most adolescents to get healthy sleep. So that's where all our work comes from. But one of the things we've learned in doing this is that sleep is kind of a sleeper of an issue if you're not a sleep person. And we have some real work to do in terms of, if we want to get start times that allow for healthy sleep, we need to educate people about sleep. We need to help them understand that it actually matters. And on top of that, even if we do get healthy start times, we need to educate people about how to use those healthy start times to get healthy sleep. So that's really where we're coming from. And that's why we do so much sleep health education in addition to specific work to ensure healthy school hours. But one of the obstacles we ran into, as many people do who create all these wonderful sleep education materials, including the AASM, is that it's one thing to create good materials. It's another thing to make sure they're actually reaching children. And of course, our schools are a great place to do that. But how do we get teachers to use these materials when they have so many other demands on them? We all think sleep is a critical issue. Unfortunately, a lot of people don't realize that yet. So this project that you're going to hear about really came out of the desire to see the wonderful sleep education materials that are increasingly created actually used by students and teachers. So I'm going to hand this over now to Phyllis and Pallas, and they'll tell you specifically what we did and what we found, and also how you can help this effort if it interests you. So Pallas and Phyllis, take it from here.
Okay, so Tara already mentioned, go back one, just to let people see like really what a big problem sleep deprivation is in our country. And then I'll pick up where Tara left off. So clearly we are all passionate about sleep and sleep health. And we see it really as a foundation of health, although other people often refer to it as the third pillar of health. We wondered when we were thinking about sleep curriculum in the schools, does it receive equal weighting? Is it seen as equal to physical activity and nutrition and other important health information that students are learning about? And does it receive any attention in the classroom?
So in addition to what Phyllis was just talking about, making sure that just seeing how sleep was weighted against these other pillars of health, we wanted to see what dimensions of sleep health were recognized in the current standards when sleep was recognized. So we wanted to know what areas were focused on and what areas needed to be improved. Talking about sleep health alone does not necessarily mean that the topic is being sufficiently covered. So it was important for us to look more deeply into exactly what was being taught. And as you can see here, we identified a number of different areas where sleep could be covered. And as we did our research, we wanted to see which of these were emphasized.
So we set out to identify sleep health objectives and state health standards to match the free content that the American Academy of Sleep Medicine and Healthy Hours have available. We wanted teachers to recognize how the content connected to what their state requires them to teach. And lastly, we wanted to share our resources with people in each state Department of Education to let them know where the gaps exist and how their curriculum could be improved, or how our materials fit into their curriculum. I searched for these key terms in the state standards of all 50 states and DC. You'll see we chose a set of sleep-related terms, and we also chose terms related to other, the coverage of other health topics in the classroom. We had some limitations as well. We didn't have the resources to check the separate curriculum of the driver's education standards, for example, or the other science classes. So we were really focused on the health education curriculum. Also, Nebraska was in the process of reviewing their standards. We reached out several times, but for that reason, we don't have data from Nebraska. So what did we find? Here's an example from Arkansas showing how physical activity is called out in the curriculum, while sleep is never mentioned. There are 35 mentions of nutrition, 52 mentions of physical activity, and 43 mentions of alcohol in Arkansas's state standards for health education. Here's another example from Maine, where I would love to see the word sleep in the list of healthy practices and behaviors that maintain or improve health. The state standards in Maine didn't include the word sleep, but had 8 mentions of nutrition and also used the words healthy eating and also called out physical activity 47 times. So overall, what we found across the 50 states in DC, or rather the 49 states in DC, sleep is not on equal footing. It is not mentioned as many times as physical activity or nutrition. Overall, our search for key terms in the standards across the US found the following total counts for each. Nutrition, 1,497. Physical activity, 1,566. Sleep, only 216. And alcohol, 1,586. So what's another example? In a handful of states, we did find sleep on relatively equal footing with the other 2 pillars of health, with Virginia standards, for example, calling out sleep 34 times, nutrition 56 times, physical activity 25 times, and alcohol 34 times. I found other useful patterns in the scope of the standards in different states and in how different states use their different approaches to develop the curriculum and content for classroom teachers. So as we dug into the work, Palace and I found that we were approaching it from very different angles. I approached the task from a very, where was sleep missing was what I wanted to know. As a former classroom teacher, I know how busy teachers are and how we rely on the content and the materials that are provided by the state. So I really wanted to see sleep, literally the word sleep mentioned. So whereas Palace was looking to connect other sort of more holistic learning objectives to sleep wherever possible, my glass was half empty. Palace's approach helped to improve the outlook. We found other helpful patterns in the data and the approaches that are used by different states, and Palace is going to tell you all about those and why they're so important.
Thanks, Phyllis. So yeah, as Phyllis was saying, she went through the keyword search, and if you look at the summary numbers, they're pretty bleak. Sleep is being shortchanged, and I 100% agree with that, and that needs to be better. But as I dug into the data, I started asking myself, maybe this isn't so bad. Looking at the standards that do exist across all of the states that we looked at, I wondered whether we could actually apply many of the existing standards to the sleep health curricular resources that we had identified. So there are a lot of different ways that I noticed that states approach their health standards. Some states get very specific, but others stay very general across the board. And many states have adopted what I refer to as the National Health Education Standards. And those were developed by a national coalition back in 1995, and they were updated again in 2007. The organization, the Society of Health and Physical Educators, is a large professional organization that represents health and physical education professionals, and they have copyright over these standards. And they are currently undergoing a review right now to update them. And many states across the country have used these standards to form the basis of their health education standards that they ultimately have adopted. Many of them have built upon them. This is really just the foundation, but they are mentioned. And if you look through the state standards in a number of states, you'll see that they're kind of organized around either these standards or a variation of these standards. And these are themes that come up time and again. And if you look at the ones that I'm showing here on the screen, you'll see that they stay very general, very high level. They don't really get into specific content areas. But you could theoretically apply various aspects of sleep health to almost all of them. So, Phyllis had mentioned kind of her keyword search, and the standards that you're seeing here are both standards that came up as a part of that keyword search. So in Michigan, for example, you'll see that in the state, they require students to analyze the importance of rest and sleep for personal health. And that's great, because if it says that, it's not going to be missed. It's very upfront that sleep should be covered. Kentucky, they had something similar that said that students need to analyze the benefits of rest and sleep. I was also, when I did my review of the data, I wanted to also include states where maybe sleep wasn't, or standards where maybe sleep wasn't specifically called out, but where our curriculum would also apply. So as an example, in North Carolina, you'll see that students are supposed to analyze necessary steps to prevent and respond to unintentional injury. So I thought, well, drowsy driving is certainly a part of that. Similarly, in Iowa, you'll actually see here, this is all formulated around one of those national health standards. Number 1 says students will comprehend concepts related to health promotion and disease prevention to enhance health. And, you know, then it gets a little bit more specific, like predict how healthy behaviors can affect health status. And, you know, to me, these relate to sleep's influence on academics, athletics, and social life, and sleep's role in physical, mental, and emotional health. And so, you know, they might not draw that connection unless we draw it for them, but I definitely think there's an argument to be made that that connection exists based on the data. So the key lessons that I came to after conducting this holistic analysis across all states, and that required a pretty close reading of all of the standards in each state, sleep can be applied to the existing standards in all states. It may not be specifically mentioned, but the standards are applicable to content related to sleep health. I agree with Phyllis that specific sleep standards that call out sleep and rest, those are preferable, but they may not be realistic in all states. Some content areas were missing in most states. Even the states that do mention sleep, they're not necessarily going to mention every dimension of sleep that we want covered. And so we still may need to use this type of holistic analysis in order to make sure that sleep is being sufficiently covered in those states. I also noticed that, you know, when states have more of a general philosophy of their sleep standards and they don't provide specific information, they sometimes have a separate resource outside of the standards where they have recommended curricular resources. And when I started to look through those resources, very rarely did I find that there was any content related to sleep health. So I identified that as another opportunity to make sure that this topic isn't being missed. And as I said before, for Phyllis, the active effort there, she identified that it would be a very active effort for us to make sure that sleep was getting sufficient coverage, especially in these areas where they're not mentioning it on an equal footing to the other health pillars. She said that was like pushing a boulder up a hill. And I agree, it was hard. It would be hard to do that. But to me, I felt like maybe the endeavor was more like pushing a boulder across a field. I agree that the sleep standards that are specific would be the best. And I think we should work towards that when it's possible. But just because that doesn't exist right now and may not for some time, I think we still need to have a continuing effort to make sure that sleep health isn't being forgotten even before there's a large scale update of all the standards. So the next part of our process, once we kind of reviewed all the standards, identifying both the specific standards that talked about sleep and the ones that maybe sleep content applied to through a holistic review, the next step was matching the content, the sleep health content that we had available to the standards. And so we used 2 sources for that. The first source was the Let's Sleep website. So our organization developed a number of curricular resources, games, animations, videos, readings related to sleep health for 6th to 12th graders. And those are available online for free for people across the country. We also knew that AASM had developed a number of lesson plans related to sleep health from K to 12, and that those were also freely available on their website. So we matched the standards in all the states to the curricular resources available on both of those different sources. So I'm going to briefly detour here. I'm going to show you guys a little bit about how this worked. Bear with me for just a moment here. Okay, so this is the Let's Sleep website. And if you come on here, let's say you're a teacher, you put in your status as a teacher. I want information for teachers, and then you can select your state. So for example, maybe I am a teacher in Colorado. And I press continue. And I'm taken to a website where I can then access a number of free educational materials. So here, for example, if I click on the topic caffeine and other drugs, I can see that we have a game available that they could share with their students called the Caffeine Challenge. And there's a little icon here that says this activity meets a curricular standard in Colorado. And this is what came out of our project. We were able to identify which activities met a standard. And so if the teacher clicks on that little link, they're taken to our Sleep Health Curriculum Standard Guide. This is what we ended up putting all the data we collected into. So now the teacher can see, okay, here's the caffeine challenge. It was made for grades 6 through 12. Here's a description of the activity. They can access the activity at this link. Here's a duration of the activity, learning objectives. And then down here, you can see that this activity is relevant to the following education standards in that state. And we link to the health standards so you can see. Alternatively, a teacher could come directly to this Sleep Health Curriculum Standard Guide, select maybe their state is Florida, and they want to find what activities related to sleep health they can use in their classroom that they can justify because it meets a state standard. So now I've selected all activities. You can see here the caffeine challenge. We just talked about that. Here are the standards it meets. Here's another activity, and here are all the standards it meets. And so on and so forth. They can scroll down. There's a number of activities in here. And they can find activities related to sleep health that they can use in their classroom and justify that use based on what is required. So let me figure out how to get out of here. And I'm going to pass it. Oh, I guess I'll make one more comment, which is that this resource that I just showed you guys is available online for free for your use. And we highly encourage you to use it and share it with the teachers and school administrators or state agency of education officials that you know. We really would like to see it be more widely adopted. And we think there's some great information in here. And
which is perfect to lead into this slide, that the other outreach efforts that we did as part of the project, we identified contacts within each state Department of Education, and we emailed them twice during the project to share our findings. And in the second email, we shared the completed resource guide and encouraged them to share it with their teachers. And also in the states that did have those other resources for teachers, we encouraged them to add our resources to that set that Palace was telling you about, that sometimes they have, here's a whole slew of resources for teachers to use when they're teaching health. And we did hear back from a couple, including Virginia, who said they would add our resources to their list. And we're hoping that through presentations like this, we can also connect with more people and use our and have help from our chapter leaders to reach out to their, teachers in their state Department of Education. So I also really want to share what we did in Virginia, because what we did in Virginia is was in the inspiration for this project overall. I met with our local legislator first, and she shared with us how the health curriculum gets updated in Virginia, and asked the people who are responsible for writing the state standards in Virginia to meet with us and share something about the process. So we knew that there's typically a 7-year cycle in Virginia. We knew it was coming up in a couple of years, and that we would have an opportunity to look at what the health standards were now and add sleep to the standards. When we started, it was only in first grade as a need, and then in seventh grade, there was a full, very rich lesson about sleep and how it impacts your health and mental health and performance. But we would really like to see it every year that health is taught. So what we did after we found out how it's done, we reached out to contacts that we had at the Virginia Academy of Sleep Medicine, and they were very interested in helping us. So when it was time for public comments, I had not just the advocates from Sleep in Fairfax helping me, but also the medical experts from Virginia Academy of Sleep Medicine. So we had this partnership examining and providing public testimony, public comment whenever it was the appropriate time. So here's an example of how our advocacy for the inclusion of sleep helped. So for what you see there, the grade 4 at the top example, only focused on nutrition. And I thought there really should be something parallel about how sleep affects personal health and academic achievement. Why wouldn't it be there? So that was one of the points of advocacy. And the new version adds, instead of just saying the student will explain how nutrition affects it, now says how nutrition and other health enhancing behaviors affect personal health and academic achievement. So actually our work ended up broadening it, not just to include rest, sleep, but also a physically active lifestyle. So now, as I mentioned earlier, the Virginia Standards of Learning for Health Education mention sleep 34 times, nutrition 56 times, physical activity 25 times. And in Palace, as Palace and I were talking about this, one of the things she was pointing out was that it's not that every single objective has to mention sleep, but it's just that we want to see when there are objectives where sleep fits in, we would like to see it included. And I am hoping that people who are watching are going to be interested in spreading the word in their own states and trying to improve how sleep is included in the curriculum. It is different in every state. That is something that we noticed. And so it is important to find out, it's not a one size fits all approach, but we do have some good models, and maybe you could speak to your own legislator to find out how the curriculum is revised in your state, what kind of a curriculum it is, and so forth. And then, of course, we want your help in other advocacy as well, not just about the K-12 standards, but healthy school start times are very important. Sleep education sleep research about health education and practice and what a difference it makes. Sharing resources with teachers. Palace, anything else?
Yeah, just wanted to, I showed it earlier that we have the Let's Sleep website where we have so many free materials on sleep education for teens, videos, animations, games, all sorts of stuff. And AASM has some great resources as well, and they're all freely available. So I just encourage everyone to share not only our standard guide where you can figure out what meets the standards in your state, but also just those resources themselves with the teens in your life, the kids in your life, and the teachers and school administrators that you know. Because I do think we have some pretty amazing resources on this topic. And the hard part is getting them used. And so we need people who care about this topic to be reaching out and letting people know that they exist. And I think if they engage with them, they will find them compelling. We just have to do the work of letting people know. So thank you guys. And I think we have a good amount of time for some questions as well.
Thank you.
Yes, thank you so much for that very comprehensive overview of the work that you've been able to undertake. I know from the beginning, I know it was a mammoth task having to find all those standards and having to find all those keywords. So thank you so much. Um, we did have a couple questions in the chat that came up. The first one was from Tracy Hall. How can we find the numbers from our specific state? And I think this was alluding to the kind of the earlier slides that you had gone through.
Alice, do you want to unshare? So
I was leaving it up in case I needed to go to the
oh,
website.
to scroll back.
That's okay. I Yeah, I mean, as far as the numbers, I mean, I think one thing is we have that tool that is available online that we created as a result of our research. And so you can go into there and you can see all of the standards that we identified in there. I don't have it organized as a grid of how many times each of the keywords was mentioned, but all of the standards that do discuss sleep or bring sleep up are in that guide. But Phyllis, since you were more of the quantitative person,
I mean, I think if you want to reach out to me, you can, and I can share the data.
yeah, and we have links. If you go and look up your state in our resource guide, there is a link that you can click on in any of the standards for your state that will take you to your state health standards directly. And it's actually doesn't take too much to, control F and you can see. I think it's actually something I recommend everybody do is look at your health standards in your state, see how it works. And
Yeah.
I think it'll be pretty interesting. I think both Phyllis and I had the reaction of saying, gosh, there's a lot of emphasis in many states on these other topics. And it just makes so much sense for sleep to be mentioned alongside, and it's not. So definitely worth familiarizing yourself.
I was really surprised in some states the emphasis on alcohol and other substances, and then really nothing about, not enough about prevention.
Yeah.
Right, thank you. So another question that came in is from Jyoti Lenka. So for adolescents with delayed sleep phase, even an 8:30 to 9 a.m. school/college start time doesn't work, what is your approach with these kids?
Well,
You're muted, Tara. Tara, you're muted.
so I was going to say my approach is one, make sure they have been evaluated by their pediatrician, because believe it or not, there's so many parents and school leaders too who are unaware that truancy problems or attendance problems can be related to sleep. And I've had parents call me whose children are involved in, they're actually in truancy court, and they're having to call a judge every morning when they're awake. And the parent is describing pulling her child out of bed and him hitting the floor and not waking up. And yet no one has thought to say, have you talked to your doctor about it? So that's one approach. And then the schools do have individual, doctors can write specialized plans for individual students to perhaps take a class online to replace a first block class, take dual enrollment at a local college where they could get credit for high school and college. So there are ways to replace that first block, but obviously we want to fix it for all kids. So we're advocating that the school system, start later. But since your question was about, the exceptions who can't even function with a 9 o'clock start, I would say then the school system needs to work with the individual family to make exceptions to help the family and the student to succeed.
Thank you for answering that. Another thank you for the presentation from one of our attendees. This individual stated, it seems like there is a lot is focused on older elementary and early adolescence. Do you have any recommendations for involvement with early elementary, kindergarten to second grade?
So this is K-12. The curriculum that we looked at was K-12, and we are suggesting that yes, sleep and sleep habits need to be part of the health curriculum starting as soon as the health curriculum starts.
Yeah, we did. Yeah, we reviewed the standards from K to 12 in this project. In terms of the resources that we were matching, The Let's Sleep resources are 6th through 12th grade, so we didn't have materials to pair to the existing standards from Let's Sleep, but AASM did develop some materials for the elementary school age children. And so we were able to match a number of standards at the elementary school level to AASM curriculum. I do think there is an opportunity to identify and expand resources for that elementary school group, because we just had many more resources for the older children, and so it covered a broader range of topics. And when we look at all the dimensions of sleep health that should be taught, I think the AASM materials are phenomenal, but there are some gaps in terms of what we were working with that I think there is an opportunity to fill and to match to the standards we've identified.
And I would say some of the states that did offer teachers extra content materials, there might be an opportunity to look at some of those and see how those would fit in, but we didn't have the time or resources to do that piece.
All right, another question that came through is actually an experience from the field, especially when it comes to start school later. So one individual indicated their superintendent flatly rejected start school later as it's not his cup of tea. How do we overcome this obstacle? And then they added to as well that most parents are on a temporary immigration status unique to our school district. Thus, they are afraid of protests and other democratic remedies.
So I will respond to that. Phyllis may want to weigh in. Unfortunately, that's a very common scenario, and it's why Start School Later was started in the first place. There were many people experiencing this in their individual districts. The research is great. The superintendents or the board would not change. And there are reasons for that. That's why we formed as an organization. So I would encourage anyone who's frustrated in their district to reach out to us. Again, you can write to us via our website. We will get back to you. In fact, Phyllis will get back to you. Our chapter leader will get back to you. We have lots of resources and ways you can talk to other people who've been dealing with this, with lots of strategies. It's unfortunately not a simple fix, but it really helps to talk to people who've been through it, to not reinvent the wheel. And we will help you as best we can, even if it's just a chance to vent. But we have made some real changes. Plus, there's work on statewide levels for legislation that will help these individual districts, even with communities, as you described, where there aren't a lot of advocates. And by the way, even if there are active parents, it doesn't always help. We are succeeding. We've already had a law passed in California and in Florida that set a guardrail on how early schools can start. And this forces the superintendents and everybody else to at least start at 8:30 or later, no matter what. Doesn't matter whether they want to or not, because it's the law. So you can get active in these statewide efforts too. And again, please connect with us, because that's what we're all about. That's what we're for. We're trying to help communities that are frustrated. And we've all been there. Some of us, unfortunately, for generations, as you can see. So,
yeah, exactly. I couldn't agree more. And I do think that, the statewide legislation is an opportunity when the local, if the response is it's not my cup of tea, or I understand the science, but, and when I hear that but, it just makes me cringe, because what that means is that really they don't have an understanding of the science. Because if they understood how critical and important it is as a public health measure to provide healthy start times, there would be no buts. It would just be how can we get it done?
Another question that came through, and just for the attendees, so they know, I did drop in the chat the Let's Sleep curriculum guide link, so you have it there for your reference. But the question that came up is, can I share the games and activities from the website with my local SSL website, which I am supposed to maintain, but often don't?
Of course. Yes.
Yes, please share everything anywhere. They are there to be used. So
yeah. And as I said, that's what we're all about. And you're a chapter leader, but even if you're not, we are trying to make these resources available to people so they're used, that's part of our mission.
Yeah.
And we want them out there. So please share them. And if you have any problems, you know where to come knocking.
And we see value in this, in the children's education, because, you know, hopefully that means they're also bringing these messages home to their parents. Like, I used to tell my dad not to smoke, you know.
So this question actually kind of came up twice, and it's related to efforts abroad across not only within the U.S. but internationally. So we have two attendees, one from Brazil, one from Canada. They kind of raised the same question, like what efforts can be made abroad. And I know one individual had asked, you know, are there any chapters abroad as well? So I don't know if you want to be able to expand on that a little bit.
I did answer privately, or at least in written form, that we actually, one of our 4 international chapters is in Brazil. So I sent a link. I think you should definitely reach out to the leaders there. They're sleep professionals, and they would love to hear from you. And there are efforts there to change start times and to raise awareness of sleep health. So Phyllis, I don't know if you want to expand on that, but
yeah, I think we have, I mean, we have one chapter leader who was translating into Portuguese, right?
Yes, yeah, they did that. And we have some people in some South American and Central American countries who've been working on things as well, translating materials. But yeah, if you have any connections there, because there are definitely efforts throughout the world, you know, on both the start time issues and of course on sleep health more generally.
Of course, there are some parts of the world where they're trying to get schools to start after 10.
Yeah, because as you've pointed out, even for kids who do not have sleep disorders, delayed circadian rhythms, 8:30 or 9 is still really early for a lot of adolescents. And that's the time class starts. That's not the time they're waking up.
Yeah, especially if they have a long commute.
But for those of you who don't know, you know, in this country, we have many schools starting in the 7 a.m. hour in the US. And kids are getting up at 5 or getting on buses at 5 or 6 in the morning. So it's quite extreme. So when you just hear start school later, people often think, oh, what's the big deal later? But there's no limit on it. And we even know some schools that start at 6:50 a.m., right? It's just appalling.
It's horrible.
Yeah.
Now, is there also a chapter in New Zealand? That was something that one of the attendees asked.
Yeah, there's not, but there has been interest in New Zealand. I've been on some radio shows there. I've seen many, many articles. There's definitely a active interest. And again, write to us. I could probably connect you with some people there if I look back through my correspondence. But yeah, there's definitely active interest in both Australia and New Zealand. Though I think Australia is like UK and starts pretty late, but they still think it's too early. But it's a big interest there.
All right, and then this will be the last question. So we have a clinical psychologist who is also an advocate for sleep with all of her clients. Her question is, what are the options for becoming certified or specialized in supporting sleep?
I actually don't know the answer to that.
I think that might be a good question for you, Vanessa.
Yeah, Vanessa, do you have an answer to that?
I don't have a specific answer. I just was wondering if you folks had something, but it seems like maybe something that we can work on.
Yeah,
I do think we have a couple of our chapter leaders who are like certified sleep educators. So there is a way to do it. I just am not that familiar with it. I looked at it and I thought I didn't have the time actually to even.
But you know what? Write to us, because I'm thinking Brendan Duffy might have an answer.
Brendan and Terry Crowley, both of them.
Yeah, yes. We have some people on our board who would have answers. So.
Yes, there's like a specific sleep health education certification that you can get.
Yeah.
Oh, and we have someone in the audience that's certified sleep educator. So there
you go.
That makes sense.
All right. Well, just to end on time, just want to thank you again, Dr. Ziprin, Pallas, and Phyllis, for joining us today and for this comprehensive overview of the work that you've done through this AASM Foundation Community Sleep Health Grant. And obviously, thank you to everyone who participated today. So for today's webinar, there will be an email that will be sent out with instructions on credit claiming. And just as a reminder, this webinar is approved for 0.75 AMA PRA credits. So this is the first of the sleep grant rounds for the year for the AASM Foundation. So what a way to kind of kick off the year. The next one will be in May, and it's actually going to be featuring Dr. Curtis's work on cognitive aging and sex differences. And then our summer webinar will feature Dr. Fiala and his work in starting up a free sleep clinic in Chicago. And then the final two webinars for the year will feature Dr. Pliska's work on oral appliance and OSA treatment. And then finally, we will have Dr. Kelly present clinical program to improve CPAP adherence in the VA healthcare system. So as you can kind of see, we were very intentional making sure that we represented sleep across all ages. So great way to start off with, our youngest audience, audience first, and then moving our way up. So registration for all these other webinars would be available soon. We'll be sending out a link with the recording, so you have that for reference for our webinar today. But other than that, thanks for joining us today, and have a good rest of the week.
Thank you so much.
Thank you.